angles on it. And the question for us clinically is, what is happening with the tree that the fruit are poisonous? When we think about the poisonous apples, we're thinking about depression, we're thinking about anxiety, we're thinking about addiction, we're thinking about post-traumatic stress disorder. Those are the diagnoses that we can place on or provide someone who has experienced trauma. But the diagnosis itself doesn't really help us get to the root of the problem. My field is in trauma. I work exclusively in the trauma field, and I'm very interested in the root system of trauma, not the outcome, not the effects of trauma that we see in the ICD-10 and the Diagnostic and Statistical Manual. So when I'm thinking about trauma, I'm always thinking of what's underneath the ground. What is causing all of these symptoms, and how do I go to the source of the problem to repair the problem at the source? Because, and the reason this matters is because if we don't get to the root system of trauma, then people will continue to manifest multiple different issues like depression and PTSD and maybe addiction, et cetera, et cetera. So how do we get to the core of the thing is my interest as a trauma specialist. So type 1 trauma is the category that is given for single incident shock focused trauma, which is like a car accident or a robbery or somebody dies unexpectedly of a heart attack and we have a traumatic loss. So what's important to think about for this category, this basket, is it is contained in time. It's a single incident. We know what happened. There was a car crash. There was a robbery. There was a heart attack. And the reason this matters clinically is because if we had a red marker, we could draw a circle around that event and focus on trauma recovery for that event. This is not trauma in the context of war. From a clinical perspective, from a recovery perspective, when you look at this image, you can see we have a coffee mug, we have a wine glass, we have a plate. Even though they're broken, we can actually see the shape of what they're supposed to be. So think of that as a metaphor for a human being who's experienced trauma. Even though they're in distress, we can see who they were before the car accident, before the robbery, before the heart attack. And clinically, with counseling and other strategies, we basically help them glue their lives back together. This is the best possible, in the world of trauma, this is the best possible and most hopeful outcome if this is the situation. Unfortunately, when we're talking about war rape in children, which last week we clarified, war rape in children is an act of genocidal rape whose purpose is to destroy the soul and the future of a nation. I want to be clear on that point. And so, when we're talking about war rape in children, we're talking about a much, much, much more complex form of trauma. And the reason for this is that children are still growing. Their physical bodies are still growing. Their physical nervous systems are still growing. Their brain is still wiring all kinds of very important things. Their identity as little people becoming bigger people is still under development. And so developmental trauma or trauma in childhood is extremely dangerous because it doesn't just harm the child, it pushes the child off the pathway of healthy psychosocial development. So it moves them from one road onto a different road, and this other road, this traumatized road, if we don't help the child get back onto a healthy road, then the long-term effects of trauma can last a lifetime. The appropriate trauma intervention of children who have been raped in this war is absolutely critical, because the lifetime implications in terms of mental health as well as physical health are quite significant. The other challenge that we face is something called attachment trauma. Attachment trauma occurs when the parent has harmed the child. Maybe the parent has been injured themselves in the war and they cannot parent their child. Maybe the parent has been killed in the war and they cannot parent their child. There's very clear evidence that children who lose their parents and become orphaned or lose a main caregiver, a primary caregiver, experience very, very serious psychosocial effects, because it's their parents' job to look after them and keep them safe and support them and help them and teach them and protect them out in the world. And if the parent is not able to do that, that has significant effect on the child's well-being. Vicarious trauma is another challenge, because everyone in this war, especially children who have been harmed, have also witnessed other people being harmed. And so adults are watching children being harmed, children are watching adults being harmed. So vicarious trauma is the fourth category of trauma. And this is when we see someone else's suffering. We see someone else's rape. We see someone else being beaten. And because we are members of a social species, because we have things called mirror neurons, when I look at someone else's suffering, I can feel it in my own physical body. When the war broke out over 3 months ago, and like the rest of the world, I was in a state of absolute shock and horror, I also experienced very, very severe empathic distress. I was sleeping badly. I was waking up multiple times in the night and checking the news constantly. And I was having a really difficult time staying grounded to work with my own patients. I was exhausted every day. And so I realized one of the things that was very distressing for me was seeing what was happening, reading what was happening, imagining what was happening, hearing what was happening, and then not being able to do anything about it. So the feeling of helplessness that I was experiencing was extremely overwhelming. And so I tried to find things that I could do to move out of that helplessness. These webinars is one thing. I'm also supporting an animal shelter and helping in other places that I can. Dr. Judith Herman, who did a wonderful talk 2 weeks ago, I think, for this webinar series, tells the story of her mother, Helen Block Lewis, who says, activism is the antidote to despair. And I was able to participate in this webinar series along with a colleague of mine, Dr. Annabelle Ruth, who is presenting on Wednesday for this webinar series. And we all believed it was very important to do something to help. And part of that is when we see the suffering, we are affected. When children see their parents suffering, they are affected. When parents see their children suffering, they are affected. And that is because we are all members of the human family. So when we're thinking about attachment styles, one of the questions that we have to consider is, when children are injured and harmed and violated during war, what is the foundation of their resilience? Can they recover? Is a fundamental question. And the answer is yes, it is absolutely possible to recover from everything that we have heard about that has happened in the last 3 months. It is possible to recover. The challenge is that just because it's possible does not mean everyone will recover. And that has partly to do with the resilience of the child, which is connected to some degree to their attachment styles. So attachment styles are like the operating system on your phone. If you have a smartphone, there's an operating system that makes it work, or on your computer. Attachment styles are the internal software that allows human beings to connect to other members of their species. And it turns out there are 4 basic styles. The first is something called secure attachment. And secure attachment is the idea that when a child is young, a small child before the age of 2, has a very positive relationship with their primary caregiver. It could be their mother, it is most often the mother, but sometimes it's the father, sometimes it's the grandmother, or someone else. Sometimes it's even an older sibling. But the child, because they are very small and very vulnerable, their survival depends on their ability to connect to somebody who's older, who can protect them and feed them and take care of them. So what we know in terms of secure attachment is attachment equals survival for small children. And small children need to be able to trust that their caregiver is big enough and strong enough and committed enough to take care of them, to look after them, to feed them, to protect them, and so on. So when a child is securely attached to their caregiver, you will see that child moving towards the caregiver when they're upset. If they're crying, they want to go to their mommy and sit in their mommy's lap. If a child goes to their parent when they are in distress, that is an indicator of a positive connection, especially if when in the presence of the parent, in the arms of the parent, the child calms down. So if you ever see a little kid crying and running to their mother and then they stop crying, that's usually an indicator that there's a good solid bond there. What we know about children who have a secure attachment with their parents is that they have a foundation of resilience that is very protective against trauma. So some of the children that have been traumatized by this war have come from very loving families, from very nurturing parents, from people who wrap around the child and soothe them and comfort them and encourage them. And that will absolutely help in terms of trauma recovery. But not all children will come from that kind of a family. So think of the inside the world of the child, as this beautiful image of a palace where all their needs are met. And so they have a very, very strong set of tools to recover from trauma. Other children come from different families and different backgrounds. And so they have a different foundation, which is less resilient. Children who come from families where the caregiver is not available, the caregiver is very busy and never around. Maybe the caregiver already has challenges with health, with mental health, with addiction, with many, many family members that they have to care for, so they don't have a lot of time for the child. When little children are in families that don't have a lot of time to nurture and spend time with them, they learn not to reach out for help. They tend to want to be near their caregiver, but they don't depend on their caregiver to look after them. They become very independent, very, very early in development. So in the West, in English, we describe them as lone wolves, people who are separate, people who stand apart. And on the one hand, they're very independent and they're quite strong because they've had to be strong their whole lives. The problem is that when trauma occurs, it's very difficult for them to reach out for support. It's very, very difficult for them to get help from other people. And we do know that getting help from other people is one of the most important ways to recover from trauma. People can suppress trauma, they can avoid trauma, they can try and put trauma in their background and pretend it didn't exist and not talk about the war and not talk about their experiences. They can do all of those things, but that is not the same as recovering from trauma and thriving after the fact. And people who come from families where everybody is avoidant, children who come from families where they're not emotionally close to their parents, there's a significant risk that they will curl up emotionally and sort of shut down and pull away. And that is quite dangerous in terms of their potential future mental health. We don't want children shutting down and pulling away because we will not know what is going on. We won't know what they're thinking. We won't know what they're feeling, and we won't know how to help. But if they already come from a family where they don't connect and they don't speak and they don't share, they don't disclose, there is a chance that when they are recovering from the war, we will see a similar pattern. There's another group in terms of attachment styles, which is called ambivalent attachment. And this is a very interesting group because unlike the children who reach out for help and the children who never reach out for help, the children in the ambivalently attached group will reach out for help, but they won't always feel better. So the idea for children reaching out for help is you reach out to the caregiver that you love and you trust so that you can feel better. So you stop crying, so that you start to smile and laugh and giggle. But what we see in the children who are ambivalently attached in this category, what we see is when they reach out to their primary caregiver, they actually don't stop crying. They're not alone, but they're not happy either. They're with their parent, but they're as distressed with their parent as away from their parent. And that seems to be because these children know that there's love in the world. So these children, everything is love. My parents will protect me. These children, nobody will protect me. I'm by myself. I'm on my own. These children are thinking, yes, I know my parents love me, but that doesn't make me feel any better. There is love in the world, but I don't trust it. And the pattern here might be that the parent is with the child sometimes and then doesn't want to have anything to do with the child at other times. Maybe the mother works 2-3 jobs and she is tired. So when she is rested, she'll play with the child. And then when she's exhausted, she doesn't. Maybe she has her own psychological trauma. And when she is feeling good, she will play with the child. And when she's depressed, she just goes to bed for 3 days. And so the child will know that it's possible to connect, but not consistently. And that inconsistency is a problem. The other possibility is if the parent is not very well attuned to the child, maybe the child is playing by themselves and they're doing very well. And then the parent intrudes on that playing time and pulls the child out of their little child world without recognizing that the parent is being very disruptive. So sometimes your parent's arrival is a good thing. Sometimes the timing is not very good. And that poor timing is a sign that the parent is not attuned. And that lack of attunement can show up as this ambivalent attachment. Essentially, children in this category just don't feel safe at all most of the time. Finally, we have disorganized attachment. And disorganized attachment is when there is abuse and violence already in the family and the child is being affected. So maybe there's issues with mental health, maybe there's issues with addiction, maybe there's issues with pre-existing trauma, maybe there's other kinds of traumatic history in the family, and the child feels very, very, very unsafe with their parents, and then the war happens. If that is the case, if a child has a disorganized form of attachment, and then there is a war and trauma, and they are assaulted or battered or attacked or raped during the war, the prognosis for them is very difficult because children with this particular attachment style do not have a strong, resilient foundation from which to bounce back when the war happens. They already have a lot of trauma in their history, and now the war is on top of that trauma. Now, it is possible to recover from this kind of trauma, and it is possible to recover from this kind of trauma even if the child was raped during the war. It is possible, but it's a very, very, very complex case. This population is the population that I work with in my clinical practice. So the body is an important consideration. Usually when we're talking about psychological trauma, we're thinking in the context of the mind. What people are thinking, what's happening with their cognition. Are they having flashbacks? Are they dissociated? What are they feeling? Are they drinking too much to cover up their feelings? But fundamentally, it's important to know that trauma is essentially and fundamentally encoded in the physical autonomic nervous system. So I like to think about all forms of psychological trauma as traumatic brain injury. And the reason for this is if you were to X-ray the physical brain of somebody who has experienced severe trauma in childhood, it does not look the same. It does not behave the same as someone who did not experience severe trauma in childhood. We do know that trauma changes the physical brain. It changes the nervous system. This has been clearly proven. A very helpful concept in terms of traumatic stress is something called polyvagal theory. Why it's important for our purposes is polyvagal theory and the treatments associated with polyvagal theory are one of the best possible interventions that we can apply to children who experienced war rape by Russian soldiers. So think of the human body as a car, and think of the body and the nervous system as the engine and the gear shift of the car. So if you're moving your body around, you're basically driving a car. When I work with my clients, I like to talk about managing the machine. So there are three fundamental gears that we want to be thinking about in the context of trauma for children and even for adults. It's the same architecture, but children's bodies are much more vulnerable because their nervous systems are still in the process of developing. So the interventions that we want to use them as soon as possible when children are still children, because if we don't provide the trauma recovery now, the likelihood of that injury and those trauma-induced changes locking in permanently is very high. So the key is early intervention, immediate intervention gives us the best possible chance in terms of trauma recovery for children raped in war. So gear one is essentially the relaxation gear. And it's a state of physiological calmness and relaxation. And every human body, small bodies as well as big bodies, child bodies as well as adult bodies, has a gear one relaxation state. But if you have trauma in your background, it's very hard to get into that relaxation state and stay there. But the relaxation state does something really interesting. When the physical nervous system is in a relaxed state, psychologically, the way that we see the world around us will change. So our body affects the way that our brain processes information. So relaxed state is gear one. Then gear two is what we all have heard about, the fight, flight, stress state. This is the state of arousal and activation when there is danger in the environment. This comes from our evolutionary history. It's not conscious, it's completely unconscious. And we focus on whatever is dangerous so that we can respond. That's the point. The problem with this second gear is after trauma, if we have seen somebody attacked, if we have seen somebody raped, if we ourselves have been raped, there's a very high likelihood that our physical body will move into this gear to hypervigilant state and get stuck there. This is the foundation of post-traumatic stress disorder. The being stuck in this stressed, hypervigilant, watching all the time, who is going to grab me, who is going to get me. This is the foundation of post-traumatic stress disorder. And it begins in the body and then flows up to the mind. The third state, which is even more dangerous, is the state of numbness. That people who not just have been attacked, but have been captured go into. So the numbness is our body's physiological response to the emotion of helplessness and defeat. And when people are attacked, if they can run away or they can fight, they're going to be in a phase 2 stressed state because they still have agency. They still have some independence. They still have some power. They still have some hope, and they will fight. As we are seeing even today, Ukrainian soldiers fighting on the front lines in the Donbass. But when they are captured, for example, in the context of war rape, when they are held down in the context of war rape, when they are completely helpless in the power of the aggressor, in the context of war rape, they will go numb. And this is the body's way of shutting down. It's the body's way of reducing the suffering, reducing the pain, protecting the mind. It's a way of escaping with your soul when you cannot escape with your body. And children do it consistently because they're too little to run away. Children are helpless. That is why we call them children. That is why they must have protectors. That is why we are all invested in helping children who were raped during the war to recover, because they cannot do it on their own. They cannot do it by themselves. And so in the act of being raped, there's a part of their brains that is shutting down. When the rape is underway, this is a protective mechanism. It reduces the feeling of pain. It reduces the awareness. It helps to reduce the horror. It helps to push away the feeling. The problem is when people survive a rape of this kind, especially as we talked about last week, war rape is 90% gang rape, almost always in public. So it's not just rape, it's also public humiliation. And it tends to be physically very, very, very violent. So the problem we have is assuming that the victim survives the rape. One of the challenges for a psychotherapist or a psychologist is the numbness of this third gear, this shut down state is very, very hard to overcome because it's protective. Because coming out of numbness almost always means moving towards pain, moving towards horror, moving towards awareness of feelings of helplessness. And so a lot of people would rather be numb. I work with many, 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 many people who were sexually harmed, abused, and raped as children. And I work with them when they are adults, and they have been numb for 20, 30, 40, 50 years. Because it's too scary. It's too terrifying. It's too painful to come out of the numbness. So from a therapy perspective, we have to think about how do we support children in coming out of that numbness, out of that stress state into relaxation. Another very important concept that Stephen Porges provided as part of the polyvagal theory was the idea of neuroception. And what he has explained to us is whatever you are feeling unconsciously in your physical body will change you emotionally, and it will also change your perception. So if I am very relaxed in my physical body, very mellow in my physical body, and someone does something upsetting in my presence, I will have a lot of resilience because of my relaxation to respond. In fact, if they do something that's very upsetting, because I'm so relaxed, I might be annoyed, but I probably won't be enraged. So the volume, my emotional volume is lower because I'm relaxed. But if I am stressed already, gear 2, if I am stressed, and then somebody does something very irritating or very upsetting, there's a really good chance that I will just fly off the handle because I'm already stressed. And so their irritating behavior just raises my stress level even more. So how my brain processes information in the environment is actually determined by what's going on in my physical body. If I'm numb, if I'm already in this gear 3 numb state, and something is going on in my environment, I might not even notice. I might not even process it or integrate it because I'm really not here. I'm so numb, I can't feel anything in here, and I don't care about anything out in the world. So neuroception is a very important concept for us because it explains why so many trauma survivors struggle with anger management. They are screaming, they're shouting, they're physically violent, they're hitting themselves, they're hitting other people. Where is it all coming from? And the answer is there's a significant likelihood that that angry, irritable person is very, very, very stressed in their physical body. And that state of stress is making them really sensitive to triggers in their environment. And they handle that by being explosive in terms of attacking other people or being explosive in terms of attacking themselves. Some people will actually start hitting themselves in the face. They won't hit someone else, but they will start hitting themselves or they'll start banging their head on a wall in this state. And this is something to watch out for in children because children are not big enough to beat up or hurt other people. So there's a real risk that that anger, that stress is going to be focused back on harming themselves. Something else to know about the biology of trauma is that trauma doesn't just change how the brain wires, the physical brain wires itself, it also changes our brain chemistry. So we have very high or low levels of stress hormone, and we have low levels of the hormone that is a reward drug like dopamine, and we have strange levels of the hormone responsible for human connection like oxytocin. So all trauma survivors go through an experiential shock, but that shock actually comes from the environment, goes right into their body, and then affects everything biologically, including brain chemistry. So what we can see with the changes in brain chemistry is that people who survive trauma don't have the capacity to manage their mood. They might have extreme mood swings. And the reality is, if they're having extreme mood swings, it's probably because something is happening at the level of their brain chemistry. So they don't know why they're having mood swings. The mood swings are happening, but if you look into their bloodstream, we can see that the chemistry, the hormones, are not what they should be. Healthy human beings have a specific recipe for a healthy brain, and trauma survivors usually don't have that recipe. Brainwaves are another important consideration. So we do know that people who experience trauma in childhood, unfortunately, because the brain is in the early stages of development, and remember that there's a lot happening in the early stages of childhood, and then so lots of things growing, and then by the time they're teenagers, there's lots of things pruning, cutting away, but still there's a lot of growth happening until their early 20s. So when you look at the brains of trauma survivors in early adulthood and later adulthood, if they had developmental trauma like war, like sexual violence, like family violence, if you look at their brainwaves, the brainwaves don't look the way they should. And the metaphor that I like to use is, imagine a musical orchestra. So kids who don't have trauma in their history, every human brain is like an orchestra. There's lots of different pieces, lots of different parts. Think of that as the violinist and the flute player and the oboe and drums and so on, because the orchestra has many, many different instruments. But all the people in the orchestra are playing from the same book, from the same musical score. So even though the instruments are different, the song they're playing is the same. That's a healthy, non-traumatized brain. But children who experience developmental trauma like war rape don't have that. Their brains, when you look at their brain waves, their brains actually are the equivalent of an orchestra with many different instruments, but they're all playing from a different book. So what's happening in terms of the brain waves of children who've experienced trauma is it's completely chaotic inside their minds. It's completely chaotic. Another metaphor that might be helpful is, in a company, any company or corporation, there's many different departments. And every department has to send an email to some other department, and that is how you keep the company going. But if one department is sending an email to another department and the email is not arriving, it's not getting through, then somebody is sending a message, but it's not being received on the other side, then the two cannot work together because they can't communicate properly. So what we know about the brains of children who experience developmental trauma, including war rape, is the different regions of their brains do not communicate properly. And that is one of the reasons that we have all of the emotional difficulties and behavioral difficulties and cognitive difficulties that children experience. The other thing to think about is the default mode network, which is fascinating. It's some of the newer science that's emerging in the trauma field. And the lead on this is Dr. Ruth Lanius and her team here in Canada. So human beings have a sense of identity, a sense of self. If we look in the mirror and we say, yes, that's me, I recognize myself in the mirror, I know who I am as a person, that feeling of being aware of my own identity actually has a physical neurological foundation. And it is primarily in what's called the neural mohawk down the center of the head. So there's a region of the brain called the default mode network, and this is the region that is active when not doing anything, we're just sort of daydreaming. That region is strongly associated with a sense of self, selfhood. And when children experience developmental trauma, this critical region of the brain will start to change its behavior. Number one, the region is not as flourishing in terms of density, but also the things that are supposed to plug in and work together don't do that. They don't do what they're supposed to do. The region of the brain does not operate the way it would in somebody who does not have a trauma history. And so that can interfere with people's sense of self and identity. Neurologically, it can interfere. The other thing is that depending on how the brain gets wired in the trauma context and how the default mode network gets wired in the trauma context, it raises the risk later on in life that the child would need very high levels of stress and trauma in order to feel like themselves. Because if my brain is wired in trauma and my identity is wired in trauma, then to feel like myself in the world 5 years later, 10 years later, 20 years later, then I'm going to need to be in trauma, because that is actually how I was built. That is what is familiar to me. I know myself in the context of trauma, and we have seen neurological evidence of this, of the different wiring of the default mode network in trauma survivors that puts them at risk for ongoing re-victimization and re-traumatization down the line. The good news is this area of the brain can be rewired, and probably the best intervention to do that is something called neurobiofeedback. Okay, let me just go through the psychological effects, and then we can go to questions. So no surprise with all of the neurological issues going on, that psychologically, because the hardware, the physical brain, the nervous system, is not behaving as it should, then psychologically, we're going to have problems. And the problems that we're likely to see include anxiety, extremely common in traumatic stress, depression, also very common, more common than post-traumatic stress disorder, by the way. These two are the most common. We will see post-traumatic stress disorder, certainly, but we will only see that in a minority of people, because the majority of people who are exposed to trauma have enough internal biological resilience to work their way through. So only a small percentage of people develop post-traumatic stress disorder after trauma exposure. Although in the context of war rape, because rape, sexual violence in any form, is highly associated with post-traumatic stress disorder, the numbers for war-raped children who experience post-traumatic stress disorder are likely to be higher. Another very, very outcome of being sexually violated, especially in childhood, and we don't talk about it enough, is dissociation. And there are two key branches that I want to bring to your attention. One is depersonalization. Just yesterday, I was in another city about 3 hours away from my home, working with a group of women who had experienced sexual violence in childhood. And I said to them, do you ever look in the mirror and not recognize the person looking back? And almost everyone in the room raised their hand. So that sense of disconnection to myself in the mirror, but even if I'm looking at my hand here or looking at my arm or looking at my body, I know this is my hand, it's my arm, it's my face. I have a strong internal awareness of that. But many trauma survivors, particularly if they were sexually violated, do not have that. They have a sense of disconnection from the face looking back at them. They have a disconnection from their own physical body. And there is a word for that. It is a real thing. They're not imagining it. It is real. It's called depersonalization, and it has to do with an alteration of physical brain networks. Depersonalization, I have experienced because I work with a lot of survivors of sexual violence. Depersonalization is one of the most common things that I come across in my practice because of the population that I work with. So it's something to be watching for always in children who have been raped in the war. The other thing, the other side of the coin from depersonalization, the other flavor of dissociation that I want to bring your attention to is something called derealization. Now, it's different. To look in the mirror and not recognize myself is one thing, but to look out in the world and have a sense that the world is separate or dreamlike. My clients have described it to me as, it's like I'm inside a glass bubble and I'm looking out and everybody else is on the other side. Or it's like I'm looking at the world, but they're very, very far away, almost as if I'm staring through binoculars. Or almost like there's a veil or a curtain between me and everybody else. That perceptual distortion, which we call derealization, is actually a neurological issue in which brain circuits are not behaving correctly. And the sense of separation and disconnection can last for years if children and young people and even adults don't learn the skills of stabilizing their physical nervous system and grounding into their bodies and then developing the capacity to remain there. So we're now at the time to take some questions if we have any, or we can take our break and then take questions after. Olena, do we have any questions in the chat?
Так, у нас одне питання. Дарина має надіслати його для Жаклін в особисте повідомлення в чаті. Вже надіслала. Зараз. Dr. Linder, do you see any questions on your personal chat?
Let me see. I do.
Okay.
Okay, I see one question. What if a child experienced sexual violence at the very young age? Should we tell the child about this event when the child gets older? If so, what age? I'm trying to think. There are no easy answers to this question. Personally, if I had a client come to me and say, which is, I have seen this, by the way, in my clinical practice, there's something wrong with me and I don't know what it is. There's something going on with my body. I have dreams, I have nightmares, I'm frightened all the time and I don't know what it is. I wish I knew what it was. What I say to clients all the time is, we don't have to have the memory because the body itself will never forget. So even if we don't have the memory and we do not want to go and dig for a memory because we don't want to manufacture a memory, we can work on grounding the physiology. So I would say that if a child was clearly exhibiting struggles of some kind, if they were having difficulty sleeping, if they were wetting the bed, if they had night terrors, if they were struggling with emotional regulation and they were old enough and didn't know why. And certainly I would not be having these kinds of conversations before maybe 12, 13, 14 years old. It can be for some, but not for everyone. It can be helpful to know that something happened. Because I work with a lot of adults who feel in their bodies that something happened, but they have no memory, they have no knowledge, they have no story, they have no explanation. And so they cannot give meaning to their experience. And that is very distressing for them. So the vast majority of people want to know, only because they want to understand what is actually going on. But really the priority is to focus on helping the child to soothe, to ground, to manage the behavior, to regulate their emotions. And if the child is growing and healing successfully and looks like they're doing well, and they don't ask about it, and there's no evidence that it's still a problem, then I personally would not open that door. I would, though, allow the child opportunities. I would say something like, if you ever want to know, if you ever want to ask about what happened, then you can ask me and I will tell you. But realistically, sexual violence at young age is such an overwhelming experience. I don't think it's important to add more unless it's necessary. I will say that for most of my clients, ultimately, they did want to know, but I didn't work with them until they were adults. And when they did know, they actually felt more relief than anything because not knowing was really confusing for them. Any other questions?
We don't have any questions, so we could take a break for 15 minutes, and after that we could continue.
Fantastic. Thank you. I'll see you all shortly.
Колеги, у нас перерва до 18:15. Тоді повертаємось.
Welcome back, everyone. Elena, I don't see anything else in the chat. Shall I continue?
Yes, we could continue because we have no questions, no wishes. So let's go.
Okay, good. Yeah, there. I'm just going to close that. Okay. So the question now becomes, how does Ukraine become a trauma-resilient society? In the West, and I don't know if it's the same in Europe, the idea of becoming trauma-informed is increasingly popular. But for Ukraine, it won't be enough. It's not enough to be trauma-informed. It's important to think about becoming trauma-resilient as a society in which the principles of trauma recovery are built in to day-to-day life. And so what I'm going to do for the next hour is walk you through some ideas, some concepts, and some strategies that may be helpful in terms of this goal. So the first idea, of course, is the recognition that because of the scale of the destruction and the harm that has been done in the war, it will not be enough for therapists alone to be responsible for the mental health recovery of the nation and all the children in the nation, those who have been raped in war, even those who were not raped in war. It will be necessary for every member of society to be somehow participating in the rebuilding and the reconstruction, both of the physical buildings as well as the psychological well-being of the Ukrainian people. And there are a lot of things that can be done at the community level in service of trauma recovery, because remember that social support, not counseling from your therapist, social support is the #1 protective factor against severe mental health outcomes after trauma exposure. And this is because the field of psychology and counseling is only over 100 years old. It's not thousands of years old, but human beings' ability to gather and care for one another in times of suffering has been going on since the beginning of human existence and will continue to go on into the future. And this now is a resource that can be drawn upon. So I want to introduce you to the idea. This is actually my idea. I was trying to think about when I was setting up this training, how to talk about the many strategies and how they can be used effectively, but also in large groups, as opposed to just one-on-one counseling or even small trauma groups of 10 or 12 people. We need to be thinking about the trauma recovery of hundreds of thousands of people. So the idea that I want to introduce you to is the idea of the community trauma resilience pyramid. And what this is taken from is what we know in the literature of trauma is most human beings will find ways to heal. That's why we are still on the earth as a species. Our own physical bodies and our own minds do have the capacity to heal on their own, even without the help of a therapist. So what we want to think about is, what can the community do? The community can do most of it, to be honest. Then those who need more than just community interventions, they need a therapist. What can the therapist do? And there's lots they can do. And then what can people do independently on their own? It's crucial in terms of trauma recovery that we not imagine trauma recovery as, I will go and see my therapist once a week. That will not be enough. Trauma recovery is like a daily practice. So we do trauma recovery hourly in our lives, daily in our lives, weekly in our lives. We build a life that is full of tools of trauma recovery. That is how we overcome. So the community trauma resilience pyramid starts with the largest groups of people and then goes up to a smaller group of people and then goes up to individual. And hopefully this will be helpful. So when we're thinking about community interventions that do not require the presence of a trained psychologist or psychotherapist or a counselor, these are some of the things to think about. All forms of play-based activities in school, in clubs, in sports teams, in community centers, in libraries, in hospitals, all forms of play have the potential to be healing for a number of reasons. One of them is that play happens with other kids. And even if you have a group of traumatized kids, when they're with one another, they instinctively move into play. They instinctively move out of distress. They instinctively can move out of isolation, although you will find in a group of children that are some are ready to play and some sort of go off and play by themselves. And those children who are isolating will need more support. But play in and of itself helps kids. Play in and of itself ensures that children are doing what children are supposed to do in terms of connecting with other children. So when we're thinking about that community trauma resilience pyramid, at the base of the pyramid, the primary community intervention for children is going to be providing as many play opportunities in every possible description as part of that community intervention. More parks, more playrooms, more toys, more teams, more games. Because the other thing that play does is it gets children together. And we know that social support heals even without the presence of a trauma therapist. So getting children together and getting them connecting and exchanging and finding areas of mastery. For example, if I'm a helpless child who has been harmed and raped in war and my family has been harmed and killed, and I have an opportunity to play with other children, and they're playing here a Lego game, my ability to build a Lego sculpture is a reminder that I have power and ability in my world. So this is a mastery exercise that can help shift people, shift children out of feelings of helplessness. It won't last forever. When they're finished playing, they quite likely will fall back into feelings of helplessness and despair. But the idea is we want to help children step out of trauma, step out of grief, step out of despair, step out of helplessness as often as we can. And I mean every single day. Visual arts is another important consideration. It's a different kind of play. It's very tactile. It draws on the child's imagination. And why that matters is because children's minds post-war, especially if they're raped during war, are going to be filled with very, very scary trauma memories. And the problem with trauma memories is that they tend to go around and around and around and around like a movie or a video that never stops. So the danger here is that ugly memory is frozen in time and works like a virus on a computer in the mind of a child. Visual arts is a way for children to take their feelings and take their memories and put them on paper, put them on canvas, put them on clay, so they can express through the medium of visual arts things that they cannot speak and things they don't have words for. So the gift of visual arts when we're working with traumatized children is there is an opportunity to process trauma without having to focus and tell the story. The child may need to tell the story. The child may never be ready to tell the story. But the fear, the rage, the anger, the humiliation has to be processed. And visual arts is one of the ways that children can communicate their experience. So it's another modality that will work for some. Remember, none of these interventions will work for every child. The reason that we need a very large toolbox with many, many, many different things is children are individual. They are unique. They're like little snowflakes. And so what we want to do is offer opportunities to the child. And some children will love one intervention and they won't love it. They'll hate the other one. So we just keep offering different opportunities to children as we draw them out of themselves, as we draw them out of isolation, as we draw them out of fear and despair and shame into healthy connection with other children as well as with adults. Now, something that is an amazing tool, and I don't know how common traditional drumming is in the Ukraine. I do know that traditional drumming does exist, that it's a very old skill, but many of us have heard of EMDR, eye movement desensitization and reprocessing, which we'll talk about a little bit later. But people are not always aware that even though EMDR was developed by eye tracking, what we have found is that all forms of what's called bilateral stimulation. Bilateral stimulation is moving two sides of the body. So you can move the eyes across the midline, but you can also move the body across the midline. And drumming, if you're doing two-handed drumming, requires that you move the drumsticks using two sides of the body in an alternating rhythm. And this is fantastic in terms of grounding the physical nervous system and bringing the physical nervous system back into stable alignment. We don't have to talk about the trauma. We don't have to remember the trauma. We don't have to disclose what happened. We just have to drum and drum and drum and drum. And what happens is people go into a deep rhythmic state of integration that helps them feel calm and grounded and relaxed. So one of the things that is an option at the community level in the Ukraine is have more drumming circles for young children and older children and youth and young adults and even adults. Music everywhere. The other thing besides the bilateral movement of the arms in two-handed drumming is you're usually drumming with other people. One of the many things that trauma does is it breaks the connection between people. Through shock and through shame, the bond between people is broken like a stick and everybody goes away. Drumming circles are a way to bring people back together. So you're not just regulating in your own physical body, you're also regulating and attuning to other human beings. And this is an incredibly powerful healing modality in terms of trauma recovery at every age of human life. Singing and humming are another community-based strategy that can be used for trauma recovery. First of all, singing activates our vocal cords, which helps to activate our vagus nerve. Humming does the same. So what's very interesting is that think of the vagus nerve, which is cranial nerve 10. It's the longest nerve in the body. It plugs into parts of your face and your heart and your subdiaphragm, your gut. All the vagus nerve is plugged into every important organ in the human body. And what's really important about it is the primary highway that moves information from the body up to the head. So about 80% of the nerve fibers go up from the body to the head, and about 20% go down. Now, what's interesting is imagine the vagus nerve, which is a crucial nerve in terms of trauma recovery. Imagine that it is a guitar string. So metaphorically, symbolically, trauma can cause the string on the guitar to become either too tight or too loose. But to play guitar, I am actually learning to play guitar. I'm not very good at it, but I try and practice a little bit every day. So I can tell you that when your guitar string is not correctly tuned, the guitar sounds terrible. But if you think of the vagus nerve as a guitar string that is either too tight or too loose, you have to tune it back into alignment with the other strings. It turns out that singing and humming do that for the human vagus nervous system. One of the things you have to do when you're singing is you have to take in big gulps of air and you have to push out that air to make sound. And that sound activates the nervous system, but you also have to do it in the presence of other people. So you have social support. I'm not alone in my song. You also have attunement with other people as part of that process, because you have to listen to other people's song so that you're on tune, and then you generate the sound from your own body using a rhythmic breathing pattern. So singing and humming are fantastic trauma interventions for reducing isolation, for stabilizing the vagus nerve, for connecting people to one another and activating the sense of social support, and also for generating feelings of mastery in people when they're able to produce a beautiful song together. So it does many, many, many things. And I will tell you that I myself, I shared last week, I'm a complex trauma survivor. I have a significant history of violence in my own childhood. That's actually why I became a trauma specialist. And I will tell you that I was part of young people's, when I was 16 years of age, I joined a choir, a church choir, until my early 20s, and singing saved my life. There's so much that happens in a group of people who sing together. I can attest, as many people have, singing saved my life. And certainly it has done the same for many, many, many trauma survivors. Now, dancing, and Ukrainian culture has a wonderful dancing tradition, is another important tool in terms of trauma recovery. If you look at the feet of these children, what you can see is that they're moving from one foot to another, one foot to another, one foot to another. As they're dancing, they're moving both sides of the body. They're moving both sides of the body in rhythm. They're moving both sides of the body in community. And what this is doing is it's stabilizing their physical nervous system. It's integrating the two sides of the body, the two hemispheres of the brain, and it is attuning them to other people. So what we're looking at is a strong community bond in rhythm, alternating bilateral rhythm with a group of children in the presence of an audience that's celebrating them. So there are multiple things that are happening here. The body is in rhythm. The community is in rhythm. The child's brain is becoming more and more synchronized as they dance. And in the presence of approving parents who are celebrating them, they are receiving warmth and love and care and admiration, and they're having a mastery experience. These children are not feeling helpless. Even if all of these children had been in the war, had been harmed by the war, and had experienced war rape, when they're dancing, as we see here, they are not thinking about the war. They're not thinking about rape. They're thinking about the music. They're thinking about the dance. They're thinking about the connection. They're thinking about the celebration, and that will help to heal the trauma experiences that they've been exposed to. Probably everyone at this webinar already knows, but I'll say it just to make it explicit, that laughter is one of the most healing things that human beings can engage in. It lowers levels of stress. It ejects all kinds of things from the body. It forces us to take large gulps of air, which regulates the nervous system. It floods our brain with all kinds of positive neurochemistry. When you laugh with another person, you connect to them, so it reduces isolation. So any communities, in fact, laughter is so powerful that there are actually therapeutic laughing groups that exist where people do not talk about their trauma, they do not talk about their stress, they do not talk about their suffering. All they do is sit in a room together and laugh and laugh and laugh and laugh. So laughter is also quite contagious, which is very helpful. So the more opportunities for celebratory comedy, laughter, joking, anything that will get somebody to burst out in laughter, that is a form of very, very important trauma recovery and regulation. Also, on the meaning-making level, in the first few weeks of the war, I was struggling to process my empathic distress and look after my patients. It was very, very difficult. And so I was working very hard with every tool I had in my toolbox to deal with my own emotions as well as my patients' emotions. And one of the things that I started doing as part of my own healing was I started bouncing on a yoga ball and laughing and laughing and laughing. I was bouncing like a 5-year-old kid and laughing and laughing and laughing. And I had a moment of awareness in that time that I wrote in my journal afterwards, which is joy is an act of resistance against tyranny and terror. And the war that is unfolding right now has many, many combatants, lots of support, and many people saying no to tyranny. But I want to offer to you that joy in and of itself is another form of resistance against tyranny. And the more comedy, the more celebration, and the more laughter that we engage in, even as the war is unfolding, that too is a psychological form of resistance against the darkness that is trying to consume us all. Theater. There is a wonderful tradition of theater in Ukrainian culture, which turns out to be incredibly beneficial in terms of trauma recovery. Number one, theater tells the story of something. So it's a way of describing events in an integrated manner that people can bear witness to. But it's different to be in the audience, where it can be very healing to go to theater, depending on what the play is about. It is incredibly healing to be an actor on the stage, especially if that actor has an experience of trauma and war rape, especially in children. And the reason for this is theater is an opportunity to step into another way of being, to practice another way of being. And so when I used to oversee a child recovery facility for children who'd been sexually abused, one of the things that we did, and I have in one of the rooms in my house, I have an entire closet full of costumes of my own, my costumes, because I was the clinical director of the facility. And whenever we had theater days for the children, I would go to work in full costume. And I would wear big crowns and giant wings and masks and long ball gowns. And I would go to work and spend the whole day in costume, just like in Halloween. And what theater can do is allow us to practice doing something different. So what we would do with the children who had been sexually abused was, if we had a child who was very frightened, very anxious, or very timid, we would dress them up as a strong, heroic warrior. And we would give them a costume, and we would give them a headdress, and we would give them a shield, and we would give them a breastplate, and maybe, you know, a Roman helmet and a spear. And for the rest of the day, they had to do live theater for everyone in the facility in the role of this hero. So whatever the child was forced with or dealing with clinically, if they were struggling with being frightened, their character and hero was the opposite. If we had a child who was struggling with anger, who was struggling with violence, who was struggling with outbursts of emotion, we would have them dress up like a doctor or a healer or an angel or somebody who meditated. And for the rest of the day in the theater, they would have to practice being that character. And what it allowed the children to do is practice inside their skin a different way of being in the world. So by the end of the day, when they took the costumes off and they went back to just being themselves, they were no longer performing the theater character, they were just being themselves. But what we noticed was a lot of the theater character, those behaviors, would show up the next day and the next week and the next month in the behavior of the child. So theater is a fantastic resource for readjusting behavior in children after trauma exposure. And you don't have to be a psychologist to do this. You just have to be somebody who can organize a play and make some costumes for kids. This is very easily done with the assistance of everyone in the community. Knitting is perhaps my favorite misunderstood and underutilized trauma recovery. Not just knitting, by the way, also beading, if people do intricate beadwork or crocheting, but I don't do that, I do mostly knitting. So what's interesting about knitting is you need two hands to do it. And when you're knitting, I knit, I'm not very good, I only know how to make scarves, but when I knit, it's a meditation, and I'm never more calm than when I'm knitting. So you take the two sticks and you have to focus on the wool, and you go back and forth and back and forth, back and forth in a rhythmic, bilateral way, back and forth, back and forth. And people who knit become increasingly grounded, increasingly relaxed, increasingly quiet and soothed inside their own bodies. So knitting circles that bring young people together and adults together in community, one of the things that will happen is, besides emotional regulation that comes just from the act of knitting, people will often talk. So knitting circles are fantastic therapeutic circles because they regulate the trauma survivor's nervous system, and they do it through community support. And it's a talking circle where people can talk about what's on their minds, whether or not they want to talk about the war. They might not want to talk about the war. They might want to talk about the family, but all of these things will help in terms of trauma recovery. So those are the community interventions that can be done without a therapist present. By the way, you can also add a therapist to all of the community interventions and make it an even more focused trauma intervention. For therapists, there's other things that therapists can do alongside the community interventions. Play therapy obviously is very important, especially for younger kids. And that is because they don't always have access to words. They don't always want to say what they think or feel. They don't always feel comfortable disclosing. So the opportunity to play, especially in spaces that have a lot of sensory toys. So things that squish, things that they can touch, blankets that are soft and they can rub the blanket, things that are heavy, like weighted jackets or weighted blankets. All of these things can be used in terms of helping the child regulate and stabilize their physical nervous system in service of their psychological resilience. For older children, talk therapy is another thing that can be done. Some children are old enough and they do want to talk. They might not talk about everything that happened. And sometimes in the context of experiences where the children were hurt, but also the parents were hurt, quite often the child will not want to talk about themselves. They might want to talk about what they saw. They might want to talk about seeing their mummy being hurt. Because for children, it's as terrifying and as traumatic for your caregiver, for your parents to be hurt than for you to be hurt, right? Both are equally traumatic. So talk therapy is one of many things that we can do. EMDR, for those of us who know about this, is another option. So EMDR is this trauma intervention. We use it specifically, or it was invented really to treat post-traumatic stress disorder. And it's a very simple technique in the sense of tracking a moving object. It can be your hand, it can be a bar, it can be a pendulum, it can be all kinds of things. But what you want is for the eyes to go back and forth, back and forth, back and forth across the midline of the brain so that two hemispheres, the right and the left hemispheres, are activated. Now, if you have a smartphone, these days when I do EMDR, I do it a lot. I have my clients use their smartphone because I do a lot of virtual therapy, a lot of virtual trauma recovery. And so you can get on your smartphone from Google Play or Apple App Store, you can get a lot of EMDR apps. Lots of apps, many of them are free. I always use the free ones with my clients. And so I'll sit in my office and I'll be looking at the client through Zoom, and they'll be in their home and the client will hold their phone and they'll be doing the eye tracking on the phone in my presence. So it's absolutely possible to do EMDR remotely very effectively. And this is an excellent intervention especially because anybody with a mobile phone can access it. But the other thing to know is that the EMDR app with this bilateral motion is not just for PTSD recovery. It's not just for trauma recovery. EMDR is a protocol. So the eye tracking is not EMDR. The eye tracking is bilateral movement. EMDR is when you take the memory and you measure it and you do a body scan, et cetera, et cetera. EMDR is a procedure. So we shouldn't be doing EMDR procedures unless we're trained to do EMDR procedures. But the EMDR app with the little eye tracker can be used for simple, basic relaxation. So even if people are not going to therapy, even if people are not receiving EMDR from a trained therapist, they can still use the eye tracker to relax. It's a fantastic modality for reducing stress. And the reason is, if you're trying to track a little object back and forth, back and forth, back and forth, back and forth across the screen, it's impossible to stay stressed because your brain is so focused on trying to keep up with this moving object that what happens is almost everyone at some point will stare and stare and stare and stare and stare, and then they'll take a deep breath and they will exhale and keep on tracking, keep on tracking, keep on tracking. By the time they finish tracking after 60 seconds, they're much less stressed than they were. I will tell you, I don't have a slide on this, but I will tell you that for those of you who are smokers, a little bit later on, I'll speak to the role of smoking in trauma recovery and stress reduction, because I want to offer you as many tools as I can. So a big part of the eye tracking is people are very, very stressed, and then they take a deep breath and they relax, and the body lets go, and the physical nervous system moves from a very tense fight-flight state into a relaxed state. And that is one of the tools in the trauma recovery toolbox. Now, I want to, if you have never heard of the Safe and Sound music app that was developed by Dr. Stephen Porges, who developed polyvagal theory, if you remember nothing else from this presentation, from this webinar, please remember this. I'm aware that the web address is in English letters. And from my side, because I'm an English speaker, what I see is all in English. But for anybody on this webinar who does speak English, if there's a way to find out how to get the information in Ukrainian, that would be very helpful, because the Safe and Sound music app developed by Dr. Stephen Porges, as far as I'm concerned, is one of the best trauma recovery tools currently available for children as well as for adults. I use it all the time. I use it every day with my clients. And the reason is because Dr. Porges designed the protocol specifically to use acoustic sound waves to basically retune the vagus nerve. So it's kind of like retuning the guitar string. So trauma survivors who are very, very tense, when they do this protocol, they find themselves becoming increasingly relaxed just by listening to music. There's a lot of science behind it, but I will show you my headphones, which are similar to what you can see on the screen. So you take the headphones, you put them over your ears. They have to be these kinds of headphones because you need the headphone to actually close over the ear. And then what happens is you connect your headphone to your smartphone. You can download very specialized music from the Safe and Sound Music app onto your phone. You can play the music from your phone. Now, it's important, this tool is only for therapists because you have to be trained to use this protocol. But from my computer, I have routinely 50 clients, 50 clients at the same time. And I have them download the music library onto their phone. And each of my clients gets a headset at home. And then I give them from my computer, I have a dashboard on my side. I can see all of their names. I'm able to give them access to the system remotely, and they are able to listen to the music at home in large groups of people in a way that is very, very healing to a traumatized nervous system. So the reason I love it is because the client does not have to be in the office with you. I also love it because large groups of people can be listening to the music at the same time, and they can listen to it for hours at a time. Typically, the protocol is a 5-hour protocol, and the healing is happening when the client is at home, and then they come in and see the therapist to talk about what has changed. It's an incredibly powerful modality, especially for children, because the children's bodies are still under development. So the sooner they have that kind of intervention at the level of the vagus nerve, the more positive the long-term outcome for children who are traumatized in war and raped in war. So it's a very exciting protocol. And I will tell you that the capacity to do this protocol at home has only happened since COVID. It's only been in the last 1.5 years that this technology has become available to everyone to use at home. Then there are trauma recovery groups. I know that Dr. Judith Herman, who is a longtime mentor of mine, spoke about trauma recovery groups. I have been in one of her trauma recovery groups for 10 years, along with my dear colleague, Dr. Annabelle Ruth, who's presenting on Wednesday. And so the trauma information group is the model where people come to group and they just learn about what trauma does to the human body and the human mind. They're very powerful. These are the groups that are for people who are not ready to do very intense emotional processing, but they want to understand what has happened. So it's a fantastic modality. The trauma information groups are excellent. The trauma recovery groups are a stage 2 group. So trauma information is stage 1, trauma recovery stage 2. These are much more emotionally difficult because those are the groups where we're dealing with the emotional aftermath of trauma and setting a goal in terms of what we want to change in our lives, in our behaviors, in our experience in the aftermath of trauma. They're incredibly powerful. And I just recently finished doing 16 weeks of a trauma recovery group on Zoom. It was fantastic. The group ended last Tuesday. And when we were wrapping up, everyone in the group spoke about how much healing had occurred, particularly for the members of the group who had histories of rape and sexual abuse in their history. The trauma recovery group was an excellent and very, very powerful modality. And of course, there's art-based therapy for those of you who are interested in this. I love this. The reason being that which you cannot name, that which you cannot speak, you can put in images, and images tell everything. You look at the image, we don't even have to speak anymore. All is said in the image. So art-based therapies are an excellent modality for people who don't necessarily want to talk about what has happened. You can also, though, use the art as the symbol and then speak a little bit about what's in the art. So it's a very, very safe way to process all forms of trauma, including war rape. Animal-assisted therapy is also a fantastic option, especially for kids, especially for trauma. Equine therapy in particular, because horses are so sensitive to emotions coming from human beings, but certainly dogs as well. A dear friend of mine, one of my closest friends here in Edmonton, Alberta, owns a large farm, and she does animal-assisted therapy with horses and dogs and cats, but she also does animal-assisted therapy with chickens, which I've never heard of, and rabbits, which I've never heard of, but it's very, very powerful, especially for children, because most children in the presence of animals come alive. Most children in the presence of animals will want to touch them and connect with them and care for them. And what this does is it brings the child out of that traumatized hypervigilant state into that relaxed, connected state, which is incredibly important in terms of their recovery. Now, these are the self-help interventions. So I want to stress, we all know this, but I want to stress that trauma recovery is an hourly experience. It's not a weekly, once a week from my therapist or once a month with my community intervention. It's actually an hourly experience. And so we need it all. We need all the community interventions. We need all the therapeutic interventions. We also need the self-help interventions, because what we want people to do is be masterful in terms of their trauma resilience. It's like physical exercise and good nutrition. We're thinking about mental health hygiene, and we want to focus on our trauma recovery in the same way that we brush our hair and we brush our teeth. And self-help interventions are very important as part of the response in terms of trauma resilience. So for the smokers in this call and those who will watch later on YouTube, I don't smoke. I used to smoke. I quit about 15 years ago. My husband's been trying to quit smoking for 20 years. We're still working on it. My only living parent has been smoking for maybe 65 years. She has no intention of quitting. She tells me this is my mother. She's a lifelong smoker. And so a lot of us have judgments around smoking, especially if we quit, because we do know that there's some significant health risks to smoking. But what smokers will usually tell you is that there's something about not just the taste of smoking, but the holding of the cigarette and the inhaling and the exhalation that is really important for them. It makes them calm. It makes them feel grounded. And so what's going on here? Yes, there's some chemicals in a cigarette that appeal to some human brains, but a huge part of what's going on is the ritual of smoking. Because when somebody has a cigarette and they inhale, they'll almost always inhale fairly quickly, and then they'll take a long exhalation and they'll blow the smoke out. Sometimes they'll make smoke rings, but most smokers will take a long exhalation and blow the smoke out. So it should not surprise anyone to learn that long exhalations are the fastest way to access the relaxation branch of the human nervous system. For those of us who are not smokers, and I'm a recovering smoker, we don't have to have a cigarette to do deep breathing exercises. We can inhale for a count of 3 or 4 and exhale long exhalations for a count of 6. Pardon me. The rule is that you want the exhalation to be longer than the inhalation. So it's a fast inhalation and a slow exhalation. And this will calm and soothe the nervous system very quickly, especially if we pair the deep breathing with an inhalation, and then as we're exhaling, we're humming. If we're making a sound like an om sound in yoga, as we exhale, that is a very, very fast way to draw the nervous system out of a fight-flight state into grounded relaxation. It's a fantastic stress reduction exercise. Because of the work that I do, I oversee a very large university program that trains counselors and psychologists, but I'm also a clinician. And so I work directly with clients. And so I practice deep breathing exercise all day long, every single day, as part of my self-care so that I am as healthy as I can be for the work that I do. You may not have heard of Stanley Rosenberg's vagus nerve exercise, but it's a very interesting one. And you can find the practice on YouTube if you Google Stanley Rosenberg vagus nerve or basic exercise. Essentially, what Rosenberg found was that when somebody, your eyes, of course, are tied into your nervous system. We know this. But it turns out that another way to help relax your vagus nerve, not just deep breathing is excellent, exhaling is excellent, but another way to soothe and stabilize and relax the vagus nerve is by looking forward and then taking your eyes and moving them as far as you can to one side of the body and holding that for about 30 seconds or until you spontaneously exhale. And then you do it on the other side and you hold for 30 seconds and then you spontaneously exhale. And there are many other exercises that Rosenberg has developed, all of which are for relaxation. They can be done very quickly. You only need 1 minute, so 30 seconds and 30 seconds, but they're quick exercises that can be done throughout the day, all day long, to basically bring the nervous system back to relaxation, back to relaxation. Our goal is emotional regulation. And emotional regulation is most successful when the body is working towards relaxation. Butterfly hugs, for those of you who know this technique, another wonderful one. You take your hands, you cross them over your body, and then you tap. It's alternating tapping, similar to the drumming and the eye tracking and the foot moving. It's alternating tapping on two sides of the body. And we can do this for a few minutes. And it's another way to relax the body and ground and stabilize the nervous system. Havening touch is a little bit of an unusual technique. I don't know if anyone's heard of it before, but it's a form of self-soothing that is really, really lovely and very nourishing. Again, you can find this technique on YouTube and you can see a demonstration of how it's done. But very quickly, what you do with havening touch, it's a form of self-care. It's a way of self-soothing. It's a way of relaxing the self by taking your hands and rubbing your hands. And then if you wear glasses, you take your glasses off and you take your hands and you very slowly brush your face in a soothing manner. And then you take both hands across the body from the shoulders using very firm strokes. Down, down, down. What it essentially mimics is when we are children and the people that we love, if we're in distress, touch our face and rub our shoulder and even rub our back. That's soothing. We will remember if we've had it before. And havening touch is a way of reconnecting with that physical sensation of soothing. It's very powerful. You can do it 3 or 4 or 5 times throughout the day, just as a form of maintaining a relaxed and grounded state. Journaling, we all know, I journal every single day. Every single day I write about what I'm frightened about. I write about what I'm angry about. I write about what I'm sad about. I write about what I'm happy about. I never read my journal entries. Some people do. I don't read my journal entries. I just write. I write them out, and in the process of writing, I gain awareness and insight of what's going on for me. So for younger children, they can do journals. I have 2 journals. I have one that I write words in, but I have another journal that I just draw in. Sometimes I don't want to put things into words. Sometimes I want to put them in images. And so for younger children, we can give them large exercise books and we can give them crayons, and then they can just draw their feelings into their own journal. And if they want to look at it later, they can. For older children, they may want to write their feelings down, even if they don't want to talk about it with anybody. They may want to write it down. Of course, it's very important that the child's privacy is respected, and that if they have a journal, that nobody reads the journal without the child's permission. Meditation is increasingly understood as one of the most powerful interventions for trauma recovery because it helps the brain focus on its own regulation. It helps the brain to ground. It helps the brain to stabilize. It helps all of the chaotic things that are going on in the mind to come back into integrated alignment. The one thing I want to caution you on is in the context of war rape, I would not use meditation, sitting meditation right away in the early stages of recovery. And the reason for this is there is a risk that when we are trying to silence the mind, there is a risk that people who have been raped during the war could fall too quickly back into their bodies and experience flashbacks and become very overwhelmed. So as we are getting people to become more regulated, I often recommend that we start with movement, because sometimes being still is just too overwhelming. So we can walk slowly in meditation. We can walk in labyrinths. We can walk in groups of people who are walking silently together. And as people become increasingly stable, as people become increasingly relaxed, as people become increasingly grounded, we can move closer and closer to a sitting form of meditation. It's really important when you're doing trauma recovery that we don't rush it, that we go slowly and carefully and methodically in a way that the survivors can tolerate and integrate and digest. Yoga is also an excellent option for the same reason that it slows the body down, but I would offer a similar caution because when you're looking at child's pose, this pose here is a description of child's pose in yoga. If a child was raped this way from behind, then this is not a pose I would recommend. So before we offer trauma-informed yoga and before we recommend yoga, we want a better understanding of what the traumatic event was, particularly in the context of war rape, because we want to know what was done to that person's body so that we do not use those poses in yoga because they could trigger flashbacks. So we want to be careful and very trauma informed when we're doing this kind of intervention. So as we're just wrapping up and going into question period, I want to offer the words of Archbishop Desmond Tutu from South Africa, who recently passed away. There is a man who lived through great suffering and witnessed horrendous suffering in his own lifetime. And the wisdom and the teaching that he leaves for all of us is hope, is being able to see that there is light despite all of the darkness. I want to offer that we know there is tremendous suffering and tremendous horror and tremendous trauma unfolding even today in Ukraine. But when you look at this image and you see the blackness of the background, and you see the colors of the Ukrainian flag wrapped around this bird who is emerging victoriously from trauma, from horror, from genocide, I have no doubt that the people of the Ukraine will prevail, that those who are still alive will help in trauma recovery. And I have no doubt that those who have suffered the atrocities of this war will be given the opportunity to heal. Thank you all for your attention. We'll move now into questions if you have any.
Дорогі колеги, якщо ви маєте питання, будь ласка, ви можете їх поставити, включивши у значку переклад звук оригіналу. І тоді пані Ліндер вас почує, і Софія зможе перекласти, або я зможу перекласти ваше питання. Звичайно, якщо вони є. I said that if our participants have any questions, they could ask you and get translated, or I will translate it for you.
Okay.
If you don't mind, may I have a word?
Yes, please.
Well, Jacqueline, I want to thank you for sharing your experience and sharing your knowledge. It's highly appreciated, and I really need it. So as many people who work with survivors, and like it's an amazing job you do. So just thank you, and thank all of the people who organized this training. So thank you, guys.
Thank you so much. It is my honor and my privilege, and being here with you is part of my healing. So thank you for being here with me.
Thank you. I think it's from all of us. I mean, I can see the comments in, so I think Elena will translate it for you.
Okay.
У нас немає питання у чаті. We have no questions in our chat. So, Dr. Linder, thank you so much for your lectures. Oh my God, they are touching me so much.
I am so very glad. And if there's anything I can do, like so many of us, I am deeply committed to the healing of the atrocities and the genocide that is happening. If there's anything more that I can do to support or help and assist in any way, please just let me know.
Okay.
Thank you, everyone. Have a good evening.
Тож, колеги, дякуємо вам за участь. Дана лекція буде викладена на YouTube-каналі, буде викладена в українському перекладі, і вона вже є в англійському, вона є мовою оригіналу, вже є на YouTube, тому ви можете передивитися. I said that I will downloading this lecture in Ukrainian with Ukrainian translation later on YouTube, and now all our participants have an opportunity to listen it in English on YouTube, because we have a live on YouTube now.
Fantastic. Thank you so much. Have a great evening, everyone, and hopefully we will do more of these trainings when the opportunities arise. And also, don't forget, there's a training on Wednesday with Dr. Ruth that I will be attending.
Так, у нас у середу буде лекція із Анабель Рут, із травматерапевтом з Німеччини. Це колега доктор Ліндер, це учениця Джудіт Герман. Тому це буде остання лекція. Можливо, ми зробимо 2 частини, але поки що плануємо одну. Зараз ми так в процесі ще обговорення. Тому післязавтра запрошуємо, Боже, я вже й не пам'ятаю той час. Слідкуйте, будь ласка, за телеграм-каналом. Я публікуватиму у Фейсбуці і у КГУ спільноті, і у спільноті всеукраїнській гештальт-спільноті. Тому шукайте посилання там.
Посилання буде нове?
Посилання те саме посилання.
Те саме, тільки час не знаєте, який, так?
Та я зараз скажу вже.
Ну, скажіть, будь ласка. Да.
3 часа по Києву.
Дякую. 3 за Києвом.
В цю наступну середу, так?
Ні, у цю середу, 1 червня, ми зустрічаємося о 3 по Києву. Друга за європейським часом, саме за Берліном, за Варшава, якщо не помиляюсь, так само цей самий час.
Дякую.
Все. До зустрічі, всіх рада була бачити. І дякую нашим перекладачам Софії, Катерині, велика вдячність. До зустрічі.